Okay, so first of all, just a little bit about webinar etiquette. So if you can keep your webcams off today, that would be great. Hopefully then we won't lose bandwidth, although we're a small group today, so we should be all right. Please keep your microphones muted. That'll keep you safe from any family incursions or office incursions. Or in my case, the tree people have turned up to chop down the trees at the back of my house. So I'll move on quickly. With regards to questions, please post questions in the chat box. If you do that as we're going along, Matt will then answer any questions at the end, as that's probably the best place to do it. We are also recording today's webinar. So before I hand over to Matt, I'd just like to say a few words about Catch. So Catch is a non-profit, industry-led membership, competency assurance and skills development organisation supporting the industry with the Humber and Yorkshire region and beyond. There are 3 distinct areas to Catch: Catch Skills, Catch Membership and Catch Technical. My name is Jill Mooney and I'm head of Catch Technical, and I'd just like to explain who Catch Technical are. So Catch Technical is a specialist team of expert consultants brought together by Catch. Our consultants can work individually on a specific project or collaboratively to manage and deliver a complex programme of work. We are supported by our partner, ESC Limited. So why might your business need Catch Technical? Change may be coming about because of COVID-19, climate change, or steadily advancing and changing health and safety requirements post-Brexit. Whether it's around regulatory compliance, supply chain operations, improving health and safety performance through workforce engagement, or delivering advanced and highly technical projects on time, Catch Technical can help you. Catch Technical consultants are a carefully selected team of technical specialists providing special project support to businesses seeking to sustain and improve in these fast-changing times. Our diverse team has over 250 years of demonstrated experience, delivering multi-million-pound projects across sectors. We pride ourselves on our collaborative approach, offering a whole project solution. Our clients, whether they be in Yorkshire, Humber or Lincolnshire, should be confident in our experience, consistent approach and trustworthiness. So that's just a bit about Catch Technical Services. You can have a look at our services on the Catch webpage, or you can contact me direct on jill.mooney@catchuk.org. Now, just moving on, I'd just like to mention 2 webinars we have coming up next week. So we're having an encore performance from one of our other consultants, Geraint Evans, on targeting net zero in the Humber region. This is a really great presentation from Geraint about the work that Catch and the LEP have been collaborating on with regards to the cluster plan and how to achieve net zero by 2040. And then our summer blockbuster release, a pre-recorded webinar from another of our consultants, Paul Sheriff, is on an introduction to risk-based inspection. And before I hand over to Matt, don't forget Catch Technical are offering 30 minutes of free telephone consultation in relation to any of the webinars we've given so far over the last few months. And after today, you'll receive a feedback questionnaire. Please take a few minutes just to give me some feedback on today and if there's any other subjects you would like webinars or training on to be delivered by Catch or Catch Technical. Thank you very much for listening to me for a few minutes. I'll now hand over to Matt and introduce Matt Longley. Thank you.
Good morning, everyone. Thank you for joining us today. I'm going to share my desktop now if I can, and there's a few slides on here. There we go. Hope everybody can see that. So we'll talk about managing mental health, and in particular, actually putting mental health into, I suppose, safety management systems. Where's my button gone? So we'll move on to that. Just a little bit about myself. I'm a chartered chemical engineer. I started my career down in South Wales with Monsanto as it was, and then became Solutia. I production for a while, and then I went into their commercial teams, working in sales and procurement of all sorts of different things. When they went into Chapter 11 back in the late 90s, I moved on to infrastructure and equipment hire. So I worked for many years for a company up in Harrogate called VP, who do small equipment hire, and then eventually ended up in the rail industry with some rather large equipment, doing track renewals, tamping equipment, that sort of thing. But during that time, I also worked for film and TV industry. So VP bought a company called TPA, who did portable roadways for crane access, and obviously other types of access into various places where you don't normally have a road. So part of their business was film and TV, and I got dispatched down to the set of Harry Potter about 11 years ago to go through. They were having all sorts of problems with invoicing, technical issues, etc. So I went down there to sort them out. And then carried on working with film and TV in the background, consulting for various businesses at Pinewood Studios, and got to know the guys down there really well. Unfortunately, about 3 years ago, one of them took his own life, a guy called Michael Harm, who was a location manager on the Harry Potter films and some of the big Pirates of the Caribbean films as well. So some of us got together, and I founded a community interest company called 6 Feet from the Spotlight, which who look after mental health of film and TV crew, because there is no corporate structure, very difficult businesses to work in. They start up and shut down very quickly. So we provide support and training for the film and TV crews, and that's expanded recently into theatre and a little bit of music as well. So some of the big bands you'll have heard of, U2 and people like that. So we've done some work with them. I'm an accredited IACT instructor as well, which I'll talk about in a bit later. But that's a training program that's just been accredited by the Royal College of Psychiatrists. And for my sins, I'm a trustee of the Men's Health Forum. The Men's Health Forum tries to look after the health of underprivileged men and boys mainly, but provides a lot of information to men, because men are particularly useless with their health, which we'll go into in a second. So I'm going to talk about the prevalence of mental health, both in normal industry and in film and TV. I'll just go through why the film and TV industry is so difficult and why there's a lot of mental health issues there, and how that might relate into into the chemical industry, obviously using my experience of having worked in the chemical industry. Look through why we should drive change, what's the duty of care to people, the legal position, how does mental health and stress impact performance, what are the commercial considerations, so what's the business case you can put forward, and then run through some solutions, because there's a lot of stuff out there at the moment which is about mental health. It's on the TV quite a lot, obviously with Prince William's got involved with football, and there's a lot of other different programs there. There's Mates in Mind, there's all sorts of things, but how do you pull those together into something you could actually put into a system? So firstly, we all have mental health. So I'm going to relate this to physical health. We all have days when we feel well mentally and physically, but some days we don't, and the two are pretty much linked. So quite often physical health will drive poor issues in mental health, but also the other way around. So if you have mental health, it can affect your physical health as well. So just bear that in mind. So in the UK, 1 in 4 people every year are diagnosed with mental health issues. So that's 25% of the population. That reduces for those of people who are in work. It's about 1 in 5. So some would say work's good for you, but there are some people with such serious mental health issues that they can't work anymore. But generally, work is good for you. Usually people are diagnosed with anxiety or depression. They're the main ones, and that can be brought on by a variety of things, such as stress, things that happen in their home lives as well, bereavement, COVID-19, and it's prevalent in various places as well. So BAME people tend to be more prevalent them. Funnily enough, as I said before, men are useless. So 75% of the people who get diagnosed are women, but 75% of the people who take their own life are men. There's various factors around that, which I won't go into in this presentation, but you can also see that 75% of people who take their own life never actually sought any help. So there's a big thing around there about getting people to get help, which is about the stigma, which is what Prince William's trying to do, is to break that stigma. In the film and TV industry, it's worse. So the film and TV charity, who I'm working with on a training program at the moment, did a survey last year of 9,000 people. They had 9,000 responses, so it's statistically significant. And 87% of people reported having a mental health issue in the film and TV industry, the people that work there. They're all pretty much freelancers. So that's partly why. If you look at the UK population now, you would get about 65% of people reporting that they have had a mental health issue. So it's significantly higher. The scary part was that significantly higher number of people had talked about or thought about taking their own life. So in the UK, the average is about 20%. In the film and TV industry, it's a whopping 55%, which is a really frightening number. I know of 7 people who've taken their own life in the last 2 years. So that is way above, it's about 30% above the normal UK average. So the film and TV industry has a significant problem. So we have to do something about it. So why is it difficult in the film and TV industry? And some of these things you will recognize from your own work life. But a lot of people work away from home and work for long hours. So there's very little work-life balance. There is so the demands on people are quite hard. At the moment, there's a lot of talk that some of the film and TV productions are starting back up again, and they've excluded COVID shutdowns from people's pay. So if a production will shut down because somebody gets COVID, then they don't get paid for 2 weeks. And they're supposed to stay and work on that production. So there's a lot of unfair contracts going on in there as well. There's bullying and harassment. So you'll have seen the Me Too movement, which kind of started with Harvey Weinstein, but there's a lot of other parts where there's bullying and harassment. And generally that's because there is very little management training. People get promoted in the film and TV industry through having been there a long time. It's kind of time served, and there's a kind of feudal system of how things work. There's very few job specifications, little corporate structure. So if you take something like Star Wars: The Force Awakens, they will start a film up, a company up just to make that film, called a production service company. They'll give it $160 million, and then when it's finished, it will fold. That listed on Companies House. The company that filmed Star Wars was called Foodles Limited, and it has 1 employee. So you can see there's a bit of a corporate structure problem, even though it's Disney, but Disney tend to divulge all of their accountability. So there's an accountability issue as well. There's no support, so there's no HR, there's nobody to talk to. You don't get sick pay, and there's no processes for if people return to work from stress or from even a physical injury. So there's no support in the film and TV industry. There is now, after last year, the film and TV charity set up a helpline for people to talk to, which is the standard employee assistance program if you work in film and TV. Every business says they're fast paced, but the film and TV industry is probably the fastest paced I've worked in. There changes all the time, either people changing jobs because they'll work on a 5-week shoot and then they'll move on to something else, or the film that I'm dealing with at the moment, where we've had 3 people work out. It's a 5-week shoot, and they got the schedule last week on Friday, and then it changed again on Monday morning. So nobody really knows what they're doing, so they have no control over what they're doing in their work or what times they're working. And everybody is freelance, so they're always worried about whether they're going to get their next role. If they speak up, do they get their next job? So there's a lot of problems around people not speaking up, a hell of a lot of presenteeism in the industry, because if you're ill or you're feeling a bit under the weather, you can't not turn up because they may not employ you on your next job. So not a great place to work. There are some good bits, obviously. People say to me, it must be glamorous. Well, yes, walking down a red carpet at Leicester Square is great, but when you're stuck on the top of a mountain in Scotland and it's February and it's snowing, it's not particularly brilliant, and all you've got to shelter in is a marquee where there might be a plastic cup of coffee or a polystyrene cup of coffee for you. So why should we drive change? And this isn't just to save lives. There are a few other reasons. So this applies to all industries. There's a legal duty of care to the mental health of workers in every industry, and that comes from the Health and Safety at Work Act, and it's regardless of their status. So in the film and TV industry, there's an issue around freelancers. People don't think that freelancers have any status, but they do. So we're trying to educate them that under Section 3 of the Health and Safety at Work Act, there is a duty of care to their health and safety, and it's not just their physical safety, it's their health. There's also sort of in the chemical industry around the contractors that you use and the suppliers that you use coming into your sites. You also have a duty of care to their mental health as well as to their physical health. The Equality Act comes into play. If somebody has had a mental health issue for some time, usually 12 months, then they can be classed as disabled, and therefore the Equality Act comes into play. And also there's the Managing Health and Safety Regulations of 1999, which require you to do risk assessments for your major risks. Stress now accounts for 54% of lost time, so it's a major it is a major risk. The HSE brought out the management standards in 2004, which set out how you can meet your duty of care to people who work for you, not just your employees, but your contractors as well. And it sets it out and meet the law. So there's quite a good structure there, but many people don't use it or even know it exists. So we'll go into that in a little bit. So if you draw a parity with physical safety, we have a moral, ethical, and legal duty to protect the mental health of your employees, not just their physical health. The Health and Safety Executive says that they will focus where they can find a systemic failure. So the film and TV industry has kind of got itself some guilty knowledge with the survey it did, and the HSE will look at what has happened in that industry before they go in and prosecute. They tend not to prosecute individual cases because obviously it's quite difficult to determine whether somebody has developed a mental health issue solely because of work, but where they see a systemic failure, they probably will go in and look at it, and that's why they brought in the management standards. They have stepped back from enforcing them simply because of their resources. So in the film and TV industry, there's quite often health and safety advisors are used on set, but they tend to look at the stunts, they look at the construction and that side of things. So they look at the physical risks, but they don't really look at the mental health risks. And your mental health of somebody, if you look at the symptoms of stress, of anxiety and depression, they're all very, very similar. And one of the issues there is cognitive behavior, and people will not necessarily perform as well, so it could affect their decision making and their performance. So there is also a need to do that. Mental health has not generally been included in safety management systems. It's usually left to HR to look at, simply because it's a people issue, but also it is a safety issue. So I'll talk about how you could possibly put mental health into your safety management system, as it is your biggest risk, or one of your biggest risks. So as I said, stress now accounts for 54% of all lost time, and that number comes from the HSE's last year's figures from the HSE. We all need a little stress and excitement to motivate us. Without it, we won't get out of bed in the morning. But if we get too much, we get toxic stress, and that inhibits your behavior, your cognitive behavior. So you make poor decisions. And there's studies around that show that 20% reduction in efficiency comes from toxic stress, and that's a minimum. So it's quite a significant reduction in the way people perform, and it impacts their safety performance. So people tend to have more accidents, and the studies that show that, whether it be on the road, whether it be at work, they do have more accidents when they are stressed, and it inhibits. I put the creative ingenuity in for when I'm talking to film and TV people, because it's their creative ingenuity. They're trying to work out how they're going to do something usually, and it does impact their creative ingenuity. Commercial considerations. People perceive there is a cost to mental health, to considering mental health of their employees, and there is, but there's also some actual savings. Deloitte did a big study, which was published back in February, and you can find that on the BBC website, the Deloitte website. But it shows that the impact of poor culture costs money, but that comes in terms of people leaving. So your resultant loss in organisational know-how. The film I'm working on at the moment, there's 3 people gone in the last week because of bad management practice. So good management practice reduces your cost. The reason I got sent down to Leavesden Studios on Harry Potter was to try and reduce the cost of Trackway that they were using down there, which was in the tune of 1.25 million. And by putting in new processes, making sure people weren't arguing about where it went and just trying to communicate better, we managed to save them probably £300,000 on that £1.25 million spend, which is quite a significant number. I suppose they could have saved a lot more by not paying the actors quite so much, but that wasn't in my remit. So there we are. Deloitte show that productivity increases equate to about, for every £1 you spend on mental health and reducing stress in your workplace, you get about £5 back, which is a pretty good rate of return. I know the IRR we used to look at in, and that's obviously going back some time, because IRR is probably slightly different now, but that going back in at Solution was about 11 to 12%. So significant difference there. And that comes in the people making the right decisions to buy things, not using as much, use of overtime if that's there, their people costs and their efficiency. But if you think everybody's having tighter budgets now, especially now with COVID and people not getting back into work, but you need good management and practice and planning, and that's all going to help with mental health and stress. Thinking about it early on is going to help. So what can we do about it? How do you get mental health into either HSD 65 or the Deming model for PDCA? So let's have a quick look at some of those ideas. So we came up with the idea of 4 pillars, which actually is used by the National Air Traffic Control Centre, which is obviously one of the most stressful jobs. They use the 4 pillars. So they have a prevention, which is key, but that's plan in the first instance to reduce stress and instances of mental health. Provide intervention, so that is the provision of trained people to support and intervene if somebody does have a bout of mental ill health. Resilience is about supporting people when they come back, but also making sure that they don't go back on the sick. My wife works for the Chemical Industries Association, and the data that she picks up is people go off for one day with a burn or a cut, or they've had something else, or a RIDDOR might be a week. With stress, it can be 280 days, 300 days, and I've had a lady who worked for me who was off for something in the region of 80 days, and other people. I walked into one job, it's a big infrastructure company, and they had 4 people off in my department of 7 people, and they were off for a long time. So you can see getting people back in, and one guy kept going on and off, but there was no structure there to help him. So resilience is really making sure that people come back. If they do have an issue, they can come back and feel supported, and stronger, and won't go back off again. And also you need to measure what you're doing. So obviously with any management system, you need to have a measurement section in there to make sure that you know what's happening and how effective anything you've done has been. So prevention is all about setting policy, having a mental health policy that's built into your health and safety policy. To improve culture, that's all about setting tone. So that has to come from the top. The leadership need to normalise the fact that they may have mental health issues themselves, and that will help prevent stigma and get people talking. Stigma is a real problem here because it means you don't know why people have gone off. A lot of people will go off with a bad back when actually they've gone off with stress, and they won't talk about it. So you never actually get to the bottom of why they've gone off. The other thing around that to break down stigma and also to make sure that people understand how they can manage mental health is have awareness, education and training. So there are various programs out there. I'll go through a couple of them later on, but there are training programs there, and there's a raft of them, but there are some good ones and some not so good ones. You have to do mental health stress risk assessments. That's it written in the law. Otherwise, you're not meeting the requirements of Managing Health and Safety 1999 or the Health and Safety at Work Act. So using the HSE management standards, perhaps there's 6 of them, they go through what demands are you putting on people, how much control do people have over the work that they do, what support are you offering them, what relationships are like, so how do you handle bullying and harassment, what role do people have, and how do they know what their role is? This is an issue in the film and TV industry, is that people don't necessarily know what their role is or what the actual aims of the organisation or the film are that they're working on. And then lastly is how do you handle change? So how is change communicated? Do people understand why you're making changes and how the changes are going to impact them, and involving them at an early stage? So those are the 6 HSE management standards. Prevention and inning plan needs to be industry or organisation specific. Obviously, film and TV industry, not everything is office based. So in the chemical industry, obviously you've got site based, so you probably might have a different plan for how you handle your operators to how you handle your staff who are in the offices. Film and TV, it's people out on location, so a location manager may be on his own for quite some time. When I worked on a Batman film, Dark Knight Rises, I was working at Woolton Hall in Nottingham for 4 months. The shoot was 2 weeks, so I was there from February to July, and the film was only there for 2 weeks, so I was pretty much on my own or with a couple of other people for a significant amount of time, so it impacts the support. You could consider, and this is what we're looking at in films, is having a wellbeing facilitator, somebody who's specifically trained to help with mental health, stress, and the well-being of staff. This is particularly key in film and TV. We trial it. That's what we're trialing at the moment, especially with people coming back from COVID. And some people get triggered by having a temperature gun pointed at their head, quite simply. So we've got people there to try and help them. And again, leadership need to normalise mental health issues and prevent their stigma. That can be done simply by the CEO or whoever it is, or even normal management talking about it. When I worked in the rail industry, people knew I'd set up 6 feet from the spotlight, so they would come to me if they had any issues at work or at home as well for advice. I can't always advise them, but I can usually find somewhere to send them to, or somebody to send them to. So a quick thing about Wellbeing Facilitator, we're using those at the moment as a trial. The response we do get occasionally is there's never time for this. Well, there is. You need to make time for it, and it will actually get you time back if everybody's working more efficiently and aren't as stressed. So we have somebody who's an ongoing presence in all the. At the moment, the film we're on is just in a house. It's one house, and I think they're out at a lavender field next week, so it's a little bit easier to do a trial. But they're there to keep the employees at work and healthy. They work with the senior management of the film, so the producers are effectively the directors, to develop mental health risk assessments. So they're shooting at a lavender field tomorrow. It's going to be hot. They've considered the safety side of it, the health and safety guys, that they need to do certain things like put easy ups out there to give people shelter, to take suntan and that sort of thing. But they're also talking about the mental health. So what can we do? Because people, when they're hot and bothered, will get stressed. So we've been talking about what we can do with that as well. Open communication. So people need to understand why they're doing something. The director of a film quite often will say, I want it done this way, and that's the way it's being done, end of. But if people actually understand, and what we've been educating the directors to do is say, this is why we're doing it, and I want the vision of this film is to look like that. When people understand that, they actually will pull behind it. There's also a lot of communication from the Wellbeing Facilitator about stress management, making sure they have time off, or making sure breaks happen at the right sort of times and that sort of thing. It's difficult in a film shoot. They do tend to all have kind of rolling breaks, but they're changing that now slowly. So intervention, this is about getting people access to professional help. The NHS obviously is swamped. couple of my family work in the NHS, and they're under in the mental health services, and it varies from area to area. So you need to know what's available in your area. Some places you have to go to your GP to get referred to. Other people, you can go straight into mental health service, straight into the mental health services to see the mental health community nurse. That depends on what area you're in. So you need to consider what professional help is available, or if your company would provide actual professional help and access into therapy, or to psychotherapists, or to psychologists, etc. Building peer network support networks is a really good one as well for intervention, because quite often somebody might have an issue. So if somebody was working for me and they have an issue with me, somebody else might say, well, I dealt with Matt by switching his email off, or by working by making sure he had this at the right time and things like that, because he was a bit of a stickler for that. So just other people, learning from other people's experiences and sharing that around, so that can help with stress and with people's mental health as well. Having a wellbeing facilitator is another one. So we can talk about mental health first aid. That's one of the things there, and I act in a second, and I'll talk you through that. I've put the film and TV charity support line there, but that relates to an EAP or an employee assistance program. So people have got somewhere confidential they can go and talk. And the other thing with intervention is, if somebody has a physical accident, they cut the finger, we go and investigate why it's happened and what's happened, and how we can prevent it. We don't do that with mental health and stress at all. It gets left to HR usually, who don't investigate it necessarily. So we need an incident reporting process. Obviously, there's confidentiality around this, but there are ways of doing this without impacting confidentiality. So taking people's names out of it, or having it with one particular person. Is one way around that. Resilience is all about measurement, is all about return to work. So plan for existing conditions. So people will be in work with you who will have already had a diagnosis of anxiety or depression. 66% of the country have, so they will be working with you and they will have recovered. So if you know about that, you can plan what is it that might trigger them, what can you do if they do have an issue, and how can you help them not have an issue as well. So you could make reasonable adjustments. So simple one is, if somebody has seasonal affective disorder, getting them lights, or getting them sat by a window. I mean, that's a really simple, I've simplified that quite a lot, but that's kind of the thing you can start to consider. And reasonable adjustments don't cost a lot. There's some studies that show they're about £75 is the cost of a reasonable adjustment for somebody. And of course you have to do them if the Equality Act is in play, because somebody is disabled due to the fact that they've had a mental health issue for more than a year. Mentoring and budding up within work as well. So when somebody does come back, give them somebody they can go and talk to who isn't their boss, or who isn't there, who isn't in authority over them. Give them somebody they can go and talk to discuss any issues that they might have. Measurement, about measuring incidents and having use of it. If people have gone to see a mental health first aider, get it recorded, but also there's other things you can use to measure. So absence, leavers, sickness, all of this sort of stuff, and why is actually measure it and see what impact you're actually having if you've made a plan. So how do you build a mental health plan? Let's have a quick look. Oops, sorry, I've done that, pressed the wrong button. So try and use the 4 pillars. The reason I say that is there's certain things fall into prevention. So there's stigma campaigns fall into prevention, but there's also a few other things that you can do, and we'll go through that in a sec. So I'm going to say prevention is key, but intervention has to come first. So the reason for that is you need to support the people who will be part of your plan. So if you put mental health first aiders in, you need to have a support plan for them in the background. They might be dealing with something that's quite hard for them. Quite often the best mental health first aiders are the people who've had lived experience of mental health issues. So you need to put a support strategy in for them. Then you need to make sure that you've got training, education, awareness. So do your managers understand their role in making improvements in mental health and stress in the workplace? Have you got people who are trained in mental health, and can you get them trained, and where can you get them trained? You need to have stigma elimination programs. Really, that's things around getting your leaders talking about it, having time to talk. Mates in Mind is one that's been successful in the construction industry, as the construction industry is quite a poor area, with it being all majority of male people there, and a lot of bravado and people being macho. So that's always had some problems. So mates in mind is one that's worked quite well. So your employees and your contractors need to feel they can talk to somebody. So eliminate that stigma. Make it positive. It's not all doom and gloom. There are a lot of positive things you can do, and that generally makes a happier workplace as well. So try and make the mental health anything you put in a plan or a program positive as well. And there's a few little tips I'll come up with in a second, and they go into more depth in some of the training. But also tailor the plan to the situation. There is no one plan that will work for everything. This isn't process safety where there's a defined route of how you do this. It's something you need to plan for in each individual case. Different people react to different things, so it's not a mathematical or an engineering solution. You should include suppliers and contractors. So use suppliers who have a mental health plan and who are good at looking after their people as well. So build that into your supply chains. So some practical actions: prevention, use time to talk. There are free resources on timetochange.org about anti-stigma that you can use. Make sure there's open communication. People should understand what they're doing and why they're doing it, and that's quite key. One thing we're trying to do in the film and TV industry is ensure that people do take a break. Just having a break for half an hour, making sure, because we all do it, work at desks. Don't take our breaks, get stuck in, but are we actually impacting our own performance when we do that, and our own mental health? So try and take your break. I'm quite often go for a walk at lunchtime or a cycle ride. Sometimes it takes a little bit longer than I thought it would, but usually I'm quite a lot more productive when I get back in. There's a thing called Wellbeing window and bite. So that's about giving yourself time at some point during the day to look after yourself, whether you read the paper, whether you listen to something, music, go for a walk, whatever it is. But also wellbeing bites are things you can do in the offices or on site. So one place I work, they used to have a word of the day, or they try and get a particular word of the day into a conversation on the phone, or have quotes walls, all sorts of things like that. Make sure you do mental health risk assessments. You have to do them. So make sure you have done a stress and mental health risk assessment, so that you understand what the key drivers are for stress and mental health issues in your workplace. Make sure you get your managers trained on a mental health session so that they know what they're doing. One idea that comes up in one of those programs is personal wellbeing plans. So understanding what drives in particular individuals, and what you should do if they do have an issue. So that's another one. Support. Have trained mental health staff, so people who understand mental health. And the main one here for me, because there was a case where somebody got prosecuted, is to make sure that people know who to speak to. There's no point having trained staff or people who can help if nobody knows who they can go and talk to. Or if you've got an employee assistance program, make sure people know about it. And there was a company who were prosecuted because somebody could have gone to an EAP but didn't know it existed. Put the peer networks in place again. And a lot of places are now putting in safe spaces where people can just go and have a break, a quiet space for 5 minutes, get away from the screens, and get away from work for a little while. So there's some of the newer film production places that are going up. I've been putting that. There's a Star Wars place in Purfleet where they're filming some of the new TV programs that are coming out, and they've got a safe space there. So training considerations, I'll just give you some ideas of what the difference is between mental health first aid and some of the management programs, one of which is IACT, which I can do. So managers ought to do IACT for managing for positive mental health, and that's because it puts in tools that can help them prevent issues in the workplace and understand how they can manage mental health and well-being, how they can connect with the colleagues or staff or contractors, how they can support someone with a mental health issue in the workplace, and what can they do to make sure that somebody can get the support that they need, but also promote positive initiatives to prevent issues. First aiders, if you think about this mental health first aid equivalent, there are a couple of people that can do it. It gives them a more in-depth knowledge into mental health conditions. You're unlikely to see all of the ones they'll learn about in the workplace. Usually it's depression, anxiety, probably bipolar disorder, seasonal adjusted disorder, but they're all forms of anxiety. And people can use that as an intervention. They signpost people for help and get them to the right place and advise probably on what should be done or shouldn't be done in the workplace. So that's first aiders. So IACT is the one I can train, which was yesterday accredited by the Royal College of Psychiatrists. So it's got some good backing there, but it's evidence-based. It comes with CPD, so if you do it face-to-face, it's 6 hours. Live, it's about online, it's about 4 hours. It's all about improving well-being in the workplace, getting access to help, connecting with others, and then a raft of tools. There's a 168-page manual that comes with it, which gives managers tools for that. And I could also do an understanding one for people who aren't managers as well. But usually the managers one is a little bit more comprehensive than the understanding one. So there's no difference in cost or time. It's just a few things are taken out. So it allows managers to understand mental health and wellbeing issues. Gives practical tools in there for promoting positive wellbeing, and there is stuff in there about the practical application of the HSE management standards as well. It equips managers with some practical tools and gives them a resource pack. There's loads of stuff online as well. IACT allow you to go online when you've done the course, and they've got more resources there. It gets updated every so often as well, so new stuff on there. A few words about mental health first aid. There are 2 providers in the country. MHFA England are the people who are the main ones that everybody's heard of, but Newco are there as well. They started up a couple of years ago, and MHFA actually sued them for copyright, but there is no real copyright in mental health at all. So MHFA England lost, and it was really just because they had a competitor in place. Newco are Ofqual registered and certified as well. So the training you get there does have good quality assurance. As far as the HSE advice is that MHFA or mental health first aid is only effective as part of a wider plan to improve mental health. A couple of businesses I've worked in have just put in mental health first aid and said they've ticked the box on mental health. That's not the case. If you think about it, physical first aid comes after an accident. So you need to be doing things to stop there being accidents, and that includes mental health accidents. So the HSE are up on that and basically say it should only be part of a robust strategy. And really importantly, you must have a support plan for MHFAs, and anybody who's done mental health first aid training needs to be able to step away from that role and have other people there to support them as well. So that's really important. A lot of people don't, mental health first aid has had a lot of press, and they're trying to get 10% of the workforce signed up to it, but it needs to be part of a bigger strategy, and I can't stress that more. Just related to physical safety. You wouldn't just have first aiders in and allow things to ammonium nitrate. So other considerations, nearly there now. Stress and mental health training can save time and money in the long run. The more people who are aware of the issues and how to deal with them, the better. I always do a podcast for film and TV, which is about mental health and how you can improve it on set. And people always say to me, well, you're not going to change the industry overnight. No, there's a Martin Luther King quote, which is, you don't have to see the whole staircase in order to take the first step. So more people are aware, the better it gets, because they understand the issues and why people might have mental health issues, and the fact that we all occasionally do have mental health issues, but we can recover as well. A little additional communication can have big benefits. Quite often, when I've been managing big teams in doing network rail contracts, just have people in every morning or every other morning and talk to them about what we're doing, why we're doing it, etc. And it saves a hell of a lot of time because everybody understands what they're doing and they're all on the same page, that kind of thing. So just a little communication can have a big benefit. So that's it. If there's any questions, please let me know. It's my contact details there. And look after yourselves. That's the main thing. So thank you for listening. Are there any questions?
Thank you, Matt. Does anybody want to come onto camera and ask a question, or ask one in the chat function?
Sure. Please, can you define exactly what a mental health accident is? I can understand a physical accident.
It was me being a little bit
yeah,
but it's around what is it that's caused. We don't investigate what causes somebody to have a mental health issue, especially anxiety and depression, and where it's work related or work related stress. We don't investigate it. So I was just trying to relate it to that kind of thing. So somebody could be triggered by certain things in the workplace over a period of time. So we don't investigate if somebody's been bullied, or if somebody has been in terms of health and from a health and safety perspective. We might do it from an HR, but we don't do it from health and safety point of view.
Okay, thank you. I like that.
Yeah.
Okay. Any other questions?
Yeah, Matt. You know, with the mental health and the health and safety, and you're doing investigations, etc. When you're doing a normal, as you know, an accidental investigation, you ask the person what they're doing, what they're trained, and this, that, and the other. But when it comes to mental health, it's more personal. And,
yes.
And the normal, but the health and safety specialists that are out there, if anything like that, it's deferred to HR, because they're the people who are trained about confidentiality, and then they can put. So is there a sort of like a working relationship that needs to be put in place between health and safety and HR? Because usually what will happen is the health and safety person will get involved. It's, say for argument's sake, there are over 7 days and we've got to report it under RIDDOR and whatever. Yeah. But to actually carry out the investigation, especially unions and stuff like that, it's farmed out to somebody else. And then when the report is done, if there's personal stuff in there, because as you know, with stress, it's not all about work. It's that there is a combination. It's like the straw that broke the camel's back. Is how do you see that sort of like fitting in? Because this is a new thing.
I think what it is that we don't put it in the management system. It's not defined as to what we're doing. We don't necessarily plan. So if you've got that plan in place and then you've got the processes and procedures afterwards, then yes, that you're right, that will go there. But if you're kind of planning then to work out how are you going to stop that happening, and HR probably might need to get involved. I mean, in instances I've had, the stress has been caused by somebody who's been bullying somebody. So then you have got an HR and a management issue. But it's kind of putting that into a systemized process, because we tend to just leave it to HR, and the health and safety guys will run off and disappear and not do anything about it. And quite rightly, yes, I know they're not always trained to that. It becomes a management issue. But we need to find a way of putting this in order to get it reducing, you need to kind of put it into some sort of system so that people understand how it fits into the organization. They've put a plan in place and they're measuring things. So if you do that, the actual mechanics of how you do an investigation are obviously quite complex, because I'm finding that now with this film I'm working on at the moment, we're getting all sorts of things, and I'm involved in the unions because there's an issue with the senior management. So it does get complicated. And very quickly it gets complicated, but we don't, in general, people don't record things in a way and say, okay, because you can completely anonymize it in the end. And what we're doing on this film is we're completely anonymizing it, not even putting their role in, because there's only one first aid assistant director on a film. So if you put first assistant director, you know who it is, that sort of thing. So does that make sense?
Yeah, it's very, very complicated, because I know from the industry I'm in, when it was first announced, mental health first aid, I was inundated with people that do first aid who all wanted to be mental health first aiders, because they see it as an addition to the first aider role. which is good, but it's the training, and I know that is expanding now. So it is good you're doing this. I think it's phenomenal. We need to actually do this.
Yeah. Well, I mean, in film and TV, we train, the first people we train were the unit nurses. They have a medic on set quite often. On the bigger productions, they have a medic, and they have several medics. So, you know, Harry Potter had a construction medic. They had a medic in the studios. They had a medic out on location. And we train those guys first because it kind of fits. And we were quite shocked, actually, that medics have less training than we were giving them. So they have about 4 hours or something like that. And we gave them more training on mental health than they'd had before. These were obviously registered nurses. So it was kind of interesting from that point of view. But then we've gone on to train the management, because it's the management that cause the issues usually, or the people you work with. So the people you work with cause the issues quite often, but also it can be the environment you're in. So, you know, I work quite a lot in doing tenders and that sort of thing, and it got quite fraught because you're obviously doing a massive tender that's worth some of the ones I was doing were getting towards £1 billion, and you've got a deadline, and you give them 4 weeks by Network Rail to do them. So but what we should have been doing is, and looking back on it, is planning how we were going to set it all up. And you spend the first week going, what am I going to do? How do I answer this question?
Yeah.
But it's about the planning. Yeah. So it's trying to get people to plan and put it into the system so that they're actually using it from there. But yeah. Does that make sense?
Yeah. Thanks, Matt.
Yeah.
Okay. Does anybody else have another question? Lawrence? Oh.
No.
Don't know. I've got a question.
Go on then.
Do you think mental health incidents should be RIDDOR reportable?
So I think I kind of touched on that a little bit in the presentation. I think it's very difficult to do that in an individual instance. I think you could. Where it's put down as work related, I think you could, because then the HSE would know. I think we had a bit of this discussion yesterday, is understanding how the HSE would know that there's an issue, and I think you could, and I think that's a way that if they had the resources, they might go. At the minute, there's far too much. The difficulty is, obviously, if I take the people I know who've had serious issues in any industry that I've worked in, it's quite often compounded with things that happen at home. And I think companies need to make sure they do support people at home with what's happening in the home life as well. But yeah, the RIDDOR side of it is difficult. And I think the HSE, I think what they should do is it becomes a RIDDOR if you have it twice. So if somebody goes off with work-related stress, you do nothing, and they come back and they go off again, then I think it should be. That's probably that would probably be the defining line. Or if you have multiple cases of work-related stress, I think in the same place. So, you know, where I went to, I had a team of 7 when I started. Got there, 4 of them were off with work-related stress before I'd started. That tells me there's something seriously wrong. That isn't because there's 4 people out of 7 have got something going in their life that means they have to be off work with stress at the same time. So that I think there are criteria that you'd put together that could make it a RIDDOR, yeah, and I think it should. I think they should go down that route, and maybe they will. I have had conversations with the HSE regarding the film and TV stuff, and they're quite keen to see something to have some teeth. I think is the key. They do want some teeth to put. They obviously spent a lot of money doing the HSE management standards back in 2004, and have never really been able to implement them properly. I think it's about 40% of companies do stress risk assessments. That's
right.
It. Yeah.
Right.
So there's a big thing for them to go at, and it is now the biggest cause of lost time. It's quite interesting when Andrea my wife does her stats, and it's 1, 2. And these are the days lost: 1, 2, 3, 4, 1, 2, 3, 4, 280, and it blows all the stats out of the water.
Yeah.
That's for stress. Yeah.
Yeah, interesting. Okay. Does anybody else have any more questions? If not, then we'll call it a day. And I'd like to thank everybody for joining today. I'd like to thank Matt for giving such a thought-provoking presentation today. I don't think I'll go and work in the film and TV industry.
It's not all that bad.